In this video, I'm going to demonstrate doing an intradermal injection. The first thing you want to do is that you have a clear written order from your physician, and you want to verify the patient's first name and date of birth. So can I have your first name and date of birth?
Roxanne Turbino, 12/29/69.
The next thing you're going to do is you want to make sure whenever you're doing an injection, you check the name of the drug, check the date and the dosage, and determine the right site and the right time and the right technique. So because this is intradermal injection, which is typically done for allergy, TB, or PPP testing, we're going to use a 27.5 gauge needle. And we want to make sure that we ask the patient if they can return 48 to 72 hours for test results. So is that okay?
Yes.
Perfect. So we're going to schedule you an appointment in the next 48 to 72 hours after today.
Okay.
Okay. So the first things first, you want to sanitize and wash your hands, and you're going to get a pair of clean gloves, and you're going to put that on. The next thing I'm going to do is I want to make sure that your arm is, you can,
This one?
Yeah, let's do this one. We're going to make sure that the needle is at a 10 to 15 degree angle. So go ahead and make sure that your arm is nice and flat. So you're going to want to take an alcohol prep wipe, and we're going to clean the area in a circular motion, pushing the bacteria away from the injection site. And then you're going to discard of that. And now we're going to make sure that you don't touch the area after we do this, because we don't want to have any irritation. And so then we're going to, at a 10 to 15 degree angle, you want to make sure the skin is taut. And you're going to go ahead and insert the needle and slightly inject the medication until it wells. So you should see kind of like a little bit of a bubble, and that means you did it correctly. After you see the bubble form, you're going to leave the area alone unless there's a little bit of blood. You're going to wipe up once, and that is it. You don't want to put a Band-Aid. You don't want to have any type of irritation. You want to, if you're taking a shower, you want to make sure that you don't really wash around this area too much in the next 48 to 72 hours until we come back. Okay. And that's the that's a TB test. In this video, I'm going to demonstrate doing a subcutaneous injection. First things first, you want to make sure that you have clear written orders from the physician. You want to verify the patient's date of birth and their name, and you want to check the name of the drug and check the dosage, making sure that you have the correct dosage on hand. After doing that, you're going to make sure that you wash and sanitize your hands and gather the correct supplies needed. I'm going to put on a pair of sterile clean gloves, and I'm going to grab a clean alcohol prep wipe. We're going to grab a bandage. And get your needle prepared. Now for subcutaneous, this is done in the back of the arm, right above the tricep muscle. Now we're going to want to do this at the needle is going to be a 25 5/8 needle at a 45 degree angle with the bevel up. So after grabbing the correct supplies, you're going to take your clean alcohol prep wipe, and we're going to make sure that we sanitize the back of the arm where we're going to do the injection in a circular motion, pushing that bacteria away from the injection site. After doing so, we're going to make sure that we grab, kind of like pinch the skin together, and at a 45 degree angle, you're going to insert the needle, aspirate, making sure that there's no blood, and then inject the medication. After pulling out, you're going to discard the needle into the sharps container. You're going to wipe the area with a clean cotton, and then you're going to put a clean bandage on the area. And that is a demonstration of a subcutaneous injection. In this video, I'm going to demonstrate doing an intramuscular injection. For this, you're going to need a 23.5 inch needle, and the doctor has ordered us to have 1 cc of medication. So you're going to make sure that the medication is at 1 cc. So that's about right there. Make sure that is in the center of the deltoid at a 90-degree angle, bevel up. So again, we're going to need a alcohol prep wipe, our needle, and a bandage. After we have all the correct supplies and we have verified the patient's date of birth and their birthday and their first and last name and the doctor's orders, we're going to go ahead and we're going to clean the site that we're going to be injecting. So again, with your alcohol wipe in a circular motion, pushing the bacteria away from the injection site, we're going to clean the area. And you're going to actually hold this with your 2 fingers and kind of like a dart, you're going to go ahead and pinch the area right here, 4 fingers away from the shoulder blade downwards, right here, and you're going to insert the needle just like a dart in a quick and swift motion. You're going to aspirate, pull back, make sure there's no blood, and go ahead and inject the medication. After, discard into the sharps container, go ahead and take this, massage the medication a little bit into the arm. Make sure that you put a clean bandage on the site, and then make sure that the patient sticks around for the next 15 to 20 minutes to make sure there's no adverse reactions. After you're doing an injection, the last step that you need to do is make sure that you write everything in the patient's chart, document everything with the time, date, and your initials. That way you make sure that there is a paper trail, because if there's no paper trail, then it didn't happen.